What are antibiotics? Antibiotics are chemicals that are released during the growth of some microorganisms. They have the ability to hinder the development of or kill other microorganisms such as fungi and bacteria. Antibiotics are specific as they only have an effect on particular microorganisms and they are chemically different from one another. Some microorganisms can manufacture more than one antibiotic and some antibiotics are toxic to humans. The antibiotic penicillin was discovered by Sir Alexander Fleming. Some bacteria that had been grown on a culture plate had been contaminated with the mould Penicillium notatum, and Fleming observed that around the area of where the mould was growing, neither bacteria was growing. Fleming suggested that the Penicillium mould released an antibacterial chemical that prevented the growth of certain types of bacteria. This chemical is penicillin, and it is still used as an antibiotic today. In 1960s America, antibiotics were given out to patients suffering from many different diseases. Antibiotics were the go-to medicine for many illnesses. It is evident that not a large amount was known about the dangers of antibiotics.
Antibiotic-resistant bacteria are fast becoming a global health concern. It is possible that this resistance can indeed lead to increased mortality rates across the globe from currently easily treated bacterial infections. This issue will be most acutely felt in developed countries where this issue stems from, due to our over-reliance on and over-prescription of antibiotics. This has already been seen. For example, many oral drugs are not effective for infections caused by resistant bacteria. Worryingly, resistant strains of TB are becoming more and more common. There were 450,000 new cases in 2012. Resistant TB requires much longer treatment courses, and these courses are significantly less effective compared to when treating non-resistant TB strains. Figures suggest that 40 to 50% of hospital-acquired E. coli are amoxicillin resistant. This has large implications for the treatment, as amoxicillin is one of the most commonly prescribed antibiotics. As many different antibiotics may have to be tried in the treatment of resistant bacteria, this vastly increases the time individuals spend in hospital, which not only increases their risk of developing other infections, but also further stretches the NHS's already limited resources.
Has gone into combating resistant bacteria, the most notable area of which is simply churning out new drugs. However, scientists discovered that a major cause in the spread of resistance is caused by ABC transporters. This is a protein that essentially transports the resistance from one bacterium to another. They came up with the ABC inhibitor, another large area of research. This, as the name suggests, inhibits the ABC transporters, allowing the antibiotics to be more effective when applied at the same time.
There are very simple ways for patients and doctors to reduce the risk of resistance, and these are: always taking the full course of antibiotics. Not finish them is a very easy way for resistance to evolve. Never take antibiotics unless they are given to you for that specific illness. Never save antibiotics or use someone else's. And doctors must make the correct diagnosis and not be pressured into prescribing drugs to patients for illnesses such as colds that would go away by themselves. For example, France managed to reduce the antibiotic output to patients by 26% after a campaign to raise awareness in doctors and patients about antibiotic abuse. There's also some new science to try and combat this problem. One of the largest problems when it comes to preventing antibiotic resistance is that drug companies are refusing to make new antibiotics because they are not profitable, but some solutions have been put forward. Firstly, genetic modification. In one case, vancomycin, an antibiotic that's been popular in treating infections like MRSA since the 1950s, has been genetically altered after some bacteria gained resistance. The antibiotic was altered slightly so it could bind to bacterial cell wall subunits and prevent cell wall assembly in bacteria more effectively. This meant the bacteria couldn't grow properly. This method was so good because there were two separate ways this functioned, meaning it was much less likely that any bacteria could become resistant. There are also antibiotic cocktails. These are when many antibiotics are given, usually at a lower dose, to treat an infection. The idea is by using different types there is a lower chance of any bacteria surviving, even if they are resistant to one, and evolving further resistance. Using this technique, multi-drug resistance could be combated.